Hello again, I'm Megan and I'm here to talk about Sign Language Interpreting, Deconstructing the Myth of Neutrality by Melanie Metzger. Um, Today I'm talking about Chapter 3. In Section 1, she talks about how to analyze medical interviews to figure out where neutrality comes in to play. There are three really important definitions for this section, which are frames, schema, and script. A frame is the way in which interactions can be understood, definitions of a situation which are built up in accordance with principles of organization which govern events and our subjective involvement in them. A good example of this would be like fighting versus play fighting. We kind of have an idea of what fighting is, and that's really serious and dangerous, and then play fighting is really harmless. So we just apply our world knowledge of like social events to analyze those encounters. Schema is a concept of dynamic knowledge structures that function as active developing patterns in an individual's memory. It is an active organization of past reactions or experiences which always are supposed to be operating in any well adapted or organic response. So an example would be like how we define something in our own head, which would be like if we use the sentence, he was on land briefly this afternoon. On land is a frame that contrasts with being at sea, and that indicates the schema of a sea voyage, even though it's not necessarily expressed. A script is a standard event sequence that orders the order that events are likely to occur in. There are three kinds of schemas. Situational, which would be like going to a restaurant or going to the hospital. Personal, which would be like if you were at a restaurant, your motivation would be to like maybe get to know the waitress or to order food. Instrumental would be like lighting a cigarette, those mechanical things, so cooking food that don't really take much thought. A good example is the restaurant script, which would be John goes to a restaurant, he asks the waitress for a coffee and a sandwich, and he pays the check and he leaves. And that's basically how it goes every time we go to a restaurant, and so that's the basis of that script. There are two reoccurring constructs in this piece, and it is perspectives and knowledge structures. Perspectives is basically another word for frames, and knowledge structures is another word for schema. In perspectives, we apply, it can be applied to activities and participants. It consists of two layers, which is the whole group view and personal views. So, so on the higher level, all of us, like in a society, look at things a certain way, and then on a lower level, each person views things in a different way. And then for knowledge structures, they refer to sort of conceptual information available to an individual, like where and how things happen, what they mean. And this can include information about settings, objects, participants, and the sequence of events. And the way that these two interact are really complex, and so as far as interpreting, they come into a section about mock interviews and a real medical interview. And so the first example in the mock interview is that a patient who is deaf comes in and has an interpreter and a doctor in one room, and the doctor is telling the patient that he has an ulcer. And so the schema includes a medical interview script, and that script is, an opening piece where everybody meets each other, tells each other their names, a medical history, an examination, a diagnosis, a consultation, and medical advice. And that's normally how medical interviews go. Everyone in this situation shares the interpreted encounter frame, but each one has a different schema for it. So in the example, the doctor keeps trying to talk to the interpreter directly and not talking to the deaf person. Like, she asked the interpreter how to sign something, how to sign ulcer. There's no sign for that, but how to sign ulcer and a few other things. And that's really not how interpreted encounters are supposed to go. The doctor is supposed to speak directly to the patient and minimize the role of the interpreter as much as possible. And then the interpreter refuses to answer the questions directed at her and not at the deaf patient, and basically just continues to interpret. The patient kind of sees the interpreter as maybe a participant or an advocate, because the patient keeps asking the interpreter for advice on like what he should do, and what kind of questions he should be asking the doctor to make sure that the doctor is being honest, or that the doctor really knows what he's talking about. And so each person has a different schema for what an interpreted encounter is supposed to go like. And so then in the real medical interview, the interpreter is with a nurse, a doctor, a deaf mother, and a sick baby. It's the same script. It's how a medical interview usually goes, which is an opening, a medical history, an examination, a diagnosis, a consultation, and medical advice. In this case, there is a frame for medical research or medical interview research, where there is a camera and a cameraman, a researcher in the room as well, and so that's added to it. Again, everyone in this situation shares the interpreted encounter frame, but they all have a kind of a different idea of how the schema is supposed to go. The doctor and the nurse don't speak directly to the deaf person. Sometimes they say, they say to the interpreter, tell her that she needs to blah, 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 which is really not protocol. They have confusion about whether the interpreter tried to give the baby medicine, because when the interpreter, so like when the deaf person signs something, the interpreter says, I tried to give the baby medicine the other day and she threw it up, blah, blah, blah. Like, the interpreter takes on the character of the deaf person, and they didn't, and the doctor and the nurse didn't know that. So they were confused about that. And then the mom also says to the researcher something. She says something to the researcher, and the interpreter says it out loud to the whole room, even though maybe the deaf person didn't intend for everything that she said to come out loud. It was nothing inappropriate, but so those were some of the schema differences for this interpreted encounter. And so Metzger calls this mismatched schemas, which means that the interpreted encounter frame was all the same. Everybody understood this is a medical interview and it is being interpreted, but no one was on the same page about the schema for it. So some of them thought that the schema for an interpreted encounter was that the interpreter is a caretaker for the child, that the interpreter was a professional service provider, which is the right one, or, well, I suppose that's not necessarily true. That the interpreter was just an ASL expert, that the interpreter was an advocate for the deaf person, that they were an advisor for the deaf person, and so everyone is just on a different page. And so the interpreter's place in this participation framework is really integral to understanding how the interpreter can influence the interaction that's going on in a interpreted encounter. So as far as neutrality goes, the person that's interpreting has to understand what schema everyone else is working on, so that they can, correct it, I suppose, to make sure that everyone understands what exactly an interpreted encounter is supposed to go like, especially in terms of the professional code of conduct. So in this section, Ms. Metzger mainly focuses on those definitions and how exactly people understand culturally and just in the United States, how they understand what an interpreted encounter is supposed to be. So in the next section, we'll be talking about a little bit more about schemas, and then seeing these play out a little bit more in the research. So the big question for today is, how do we correct it when everyone is working on a different schema?